Mrs. Cherry is a registered dental hygienist and recent graduate from Gucci University. She has recently been hired by Dr. Vera Wang's office and works on Wednesdays and Thursdays. Dr. Wang has been a practicing dentist for over 35 years and is very set in her ways. On Wednesday morning, Mrs. Cherry sees her first patient, Tom Ford. Mr. Ford is a middle-aged businessman who is a longtime patient of Dr. Wang's. He has a past history of smoking and was diagnosed with type 1 diabetes when he was a young boy. Upon examination of his oral tissues, Mrs. Cherry noticed a 2 by 1 centimeter white hyperkeratinized area on Mr. Ford's left lateral border of his tongue. Mrs. Cherry informed Mr. Ford of her findings and asked him if he had ever noticed it before. Mr. Ford said, "Where? I've never noticed it. I don't feel anything. Can you show me where it is?" Upon showing Mr. Ford the lesion, he is very shocked and concerned at what he sees. Mr. Ford starts rambling off questions to Mrs. Cherry.
What is that thing? Am I gonna die? Can you clean it off? Do I need surgery?
Mrs. Cherry reassured Mr. Ford that they will take every step necessary to make him comfortable, that she will have Dr. Wang take a look. Upon Dr. Wang entering the exam room, Mrs. Cherry informs her of Mr. Ford's suspicious lesion. After checking the lesion, Dr. Wang says it does not look pathologic. Dr. Wang tells Mr. Ford she believes it to be a self-induced lesion that should heal within 2 weeks, and there's nothing to worry about. Mr. Ford feels relieved after hearing Dr. Wang's diagnosis. However, Mrs. Cherry is still feeling apprehensive about the lesion. She knows about Mr. Ford's long history of smoking and how the lateral borders of the tongue are high-risk areas for cancer lesions. Mrs. Cherry approaches Dr. Wang and expresses her concern about Mr. Ford's lesion. Dr. Wang disregarded Mrs. Cherry's concern and told her to schedule his 6-month recall and dismiss him. After Mrs. Cherry is finished with her first day at Dr. Wang's office, she can't seem to forget the lesion she found on Mr. Ford's tongue. She questions whether or not she should have done something more. She knows her professional obligation to Mr. Ford is to provide a thorough cancer oral screening and refer any suspicious lesions. Should Mrs. Cherry confront Dr. Wang? Is her new job in jeopardy if she does? Does Mrs. Cherry have the obligation to report Dr. Wang? Lastly, should Mrs. Cherry consider quitting her job to avoid the situation? After a long night of heavy consideration, Mrs. Cherry decides she is going to approach Dr. Wang about the suspicious lesion on Mr. Ford's tongue. Upon arriving for her second day of work, Mrs. Cherry is feeling quite apprehensive. She confronts Dr. Wang prior to her first patient and asks if they may discuss the lesion she discovered yesterday. Dr. Wang is open to the idea and invites Mrs. Cherry into her office for them to speak privately. Mrs. Cherry presents many respectable reasons why it is important for them to further investigate Mr. Ford's lesion. She states that with his history of smoking and the location of the lesion, he is at a high risk for developing oral cancer. Tobacco is by far the most prevalent risk factor for oral cancer, and it is most commonly found on the lateral borders of the tongue. Mrs. Cherry reminds Dr. Wang that as dental professionals, it is our responsibility to provide the highest standard of care for every patient who sits in our chair. This would include options varying from Mr. Ford coming back in 2 weeks to further reevaluating the lesion and observing any changes in size or shape, perform an in-office brush biopsy, or refer out to an oral pathologist for a second opinion. Mrs. Cherry stresses to Dr. Wang that failure to abide by these standards of care could result in a malpractice lawsuit because it would be breaking the ADA Code of Professional Conduct seen in Section 2, Code 2.B.1. After Mrs. Cherry expresses her concern, she sees a notable difference in Dr. Wang's mannerisms. Dr. Wang admires Mrs. Cherry's opinions that she brought to her attention, and says she is willing to compromise with her and have Mr. Ford return to the office in 2 weeks to re-examine the lesion. After further investigation and upon changes to the lesion, Dr. Wang will refer him to the oral pathologist for a second opinion.